For the scholarly committee, the chair will be Dr. Vatcher, the mentor is Jessica Carlin, and the second reader is Dr. Ellis. Introduction. It is estimated that 9.4 million adults in the U.S. have adult ADHD. According to the World Health Organization, the prevalence of adult ADHD in the U.S. is about 5.2%. Researchers note that adult ADHD undiagnosed results in reduced quality of life measures for adults with ADHD. Adult ADHD can manifest in many ways, affecting functioning levels, interfering with the ability to get ready for work, employment, relationships, and issues completing tasks. Problem statement. Can an educational intervention increase healthcare providers' confidence when diagnosing adult ADHD? Background. Summary of key points. Healthcare providers with limited experience and lack of education with adult ADHD can create barriers in both primary care and psychiatric settings in feeling confident in diagnosing adults with ADHD. Improved education and increased knowledge can inform care and reduce challenges for providers in diagnosing adult ADHD. Raising awareness through educational interventions regarding increasing familiarity and recognizing adult ADHD can promote increased confidence for healthcare providers to effectively identify and diagnose adult ADHD. Summary of key points. ADHD is a well-established persistent disorder. However, the diagnosis of adult ADHD is often misdiagnosed in clinical settings due to the complexity of the disorder and confusion over co-occurring disorders. The DNP nurse plays a vested role in understanding patient care and finding solutions to influence macro changes in promoting healthcare provider confidence in diagnosing adult ADHD. Quality care measures are needed to accommodate improvements to improve provider confidence levels using evidence-based practices to develop needed changes in care models and systems. A current intervention to improve provider confidence in diagnosing adult ADHD is a program called the Adult ADHD Quality Measures Initiative, which developed a 4-stage process to ensure quality measures in diagnosing and treating adult ADHD. The scholarly project aims to address interventions to improve healthcare provider confidence through an educational approach which promotes proper diagnosis and treatment of adult ADHD. The scholarly project will use quantitative descriptive statistics to examine healthcare provider confidence levels. Project aims. The purpose is to examine the confidence levels of healthcare providers to diagnose adult ADHD in healthcare settings. The objective of the study is to investigate if using an educational intervention will improve confidence levels of healthcare providers to diagnose adult ADHD. Research clinical question hypothesis. Looking at healthcare providers' confidence levels, what is the change post-confidence when tested between July through September 2025 from baseline? Is there a difference between the pre-test confidence levels associated with watching an educational video? Empirical literature. A systematic review of literature will provide supportive evidence for the lack of confidence amongst healthcare providers in providing a diagnosis for adult ADHD. The research engines will use to explore the literature review will be CNL, Medline, PubMed, Elsevier, Google, Scholar, and the Journal for Nurse Practitioners. Supporting literature. The literature review is gathered and put together using search engines. The search engines will scan for words adult ADHD, diagnosis, screening tools, comorbid, and separate between qualitative and quantitative research, including research methods for both empirical and non-empirical studies. For the use of the SPP project, the systematic review of literature regarding the quantitative studies and confidence levels for healthcare providers in diagnosing adult ADHD. The literature review will provide confidence levels and issues related to why adult ADHD is misdiagnosed and challenges by providers due to lack of proper diagnosis. Theoretical and conceptual framework. Benner's novice to expert theory illustrates an organized method to demonstrate if a learner can develop an acquired skill over time. Benner in 1984 cites learners can develop competency through 5 stages: novice, advanced beginner, competent, proficient, expert. Learning is not linear. The learner can move back and forth. The goal is competency. The aim of the scholarly project is to improve healthcare providers' confidence through learning. And this is an example of Benner's expert theory stages of proficiency. So we start out with novice, advanced beginner, competency, proficiency, expert. Philosophical assumptions. The DMP scholarly project philosophy is to focus investigating the gaps in care through scholarly advanced understanding and skilled directives to translate nursing processes and implement improvements to patient care collectively and individually through an in-depth knowledge of patient needs and perspectives. Evidence-based model. The Stephen Starr model of the 5 steps knowledge translation evidence-based model will be used to guide the project. The Starr's model 5-step process is discovery, summary, translation, implementation, and evaluation to guide the QI project. Project instruments. The instruments used will be Qualtrics to collect the data. The Susan Grundy's competency scale will be used to determine confidence levels, healthcare providers post-test, pre-test. The project lead will set up the Qualtrics to add 5 statements using the C scale. G-Power software will be used to calculate the sample size. Once the sample is collected, a t-test will be used to compare healthcare providers' confidence levels before and after watching educational video. The Stephen Starr model will summarize, interpret, and integrate the data into the project. The project lead will use the Qualtrics software to collect the data and the Intellectualist software to analyze the data. This is an example of the Susan Grundy C scale. And we have the 5 steps, at varying degrees of confidence levels. Can educational interventions assist providers increasing their confidence in diagnosing adult ADHD? Sample setting. The sample setting will be recruited from a convenience sample based on availability in outpatient provider settings. The project lead will select the sample based on the representation of the population, including all races, nationalities, gender, to ensure a broad, diverse sample stratification in the northeast of Massachusetts. The scholarly project recognizes the importance of transferability and generalizability as part of the goals of the research project. To improve the reliability, the project lead will use the G Power 3 software to determine statistical power and the sample size of 34 for the project using the one-tailed priori and alpha 0.05. Participants for the scholarly project will be recruited through a universal office email and announced weekly at clinical Zoom meetings. Flyers for the study will be left in the office break room. The project lead will initiate the study by sending out an invitation to the participants in the study by downloading a QR code and the use of Qualtrics software, which will contain the informed consent, the study project, along with a pre-test, post-test educational video. Inclusion: must be 18 years of age, must hold a healthcare provider license in Massachusetts, must be able to diagnose adults with ADHD in clinical settings, and must read and write English fluently. Exclusion: must not be less than 18 years of age and must not struggle with understanding English. Informed consent. Guidelines provide an overview for any potential harm or cost to crucial members volunteering, specifically when there is a potential for any injury associated with the efforts to improve quality, safety, and care related to healthcare. Given this, the DMP Scholarly Project must consider respect for human dignity and the individual's autonomy as part of a long-standing standard for basic research and ethics. Consequently, the DMP Scholarly Project emphasizes research ethics and voluntary consent, which must be obtained. Furthermore, the DMP Scholarly Project must get approval and adhere to the Institutional Review Board's guidelines. The Institutional Review Board must be in place for any research protocol with human participants. Research variables. A t-test assumes that the sample study is normally distributed. The t-test will be used to compare the variable to a hypothesized mean. The project lead will analyze the mean of the sample C-scale pre-test and hypothesize the mean C-scale post-test to determine if there are any differences that occur. Once the sample t-test will be used to verify if the sample is statistically different from the hypothesized value. The sample t-test will compare the single sample mean to a specific constant. The scholarly project will use one sample mean for the t-test, as there cannot be two or more sample groups, or a one-way NOVA would be used. Measurements. Data will be collected using Qualtrics. The project lead will send out an invitation for a sample survey. The QR link to the Qualtrics will contain the informed consent, the C-scale, the confidence test, the pre-test, and the post-test, along with the educational video. Quantitative data will be collected. A t-test will be used to compare confidence levels after pre-test and post-test to see if there are any changes to interventions. The survey will be collected on Qualtrics using a convenience sample. After collecting the data, it will be loaded onto an Excel spreadsheet. Then the spreadsheet will be uploaded to the Intellect software for statistical calculation of the t-test and analysis. Plan for data collection. Participants for the scholarly project will be recruited using a universal office email and through weekly Zoom meetings. Flyers for the study will be left in the break room. The project lead will initiate the study by sending out participants and downloading QR codes. The project lead will use Qualtrics software to collect the data and an Excel sheet to upload the data into the Intellectuous software.